An estimated 6 million Americans, 1 in 50, have an undetected brain aneurysm. Every year, nearly 30,000 of these aneurysms rupture, killing half of the victims within minutes. Those that survive may suffer a delayed death or permanent disability.
That when an aneurysm ruptures, you have bleeding within the brain. The blood enters this berry-shaped structure, which is very thin-walled, and over time, this structure, this balloon, this berry aneurysm can grow and rupture. And if it ruptures, it can cause a catastrophic stroke-like presentation. It's sudden onset. It can lead to, in some cases, instantaneous death if it's a very large aneurysm that ruptures in a very bad location.
There are several factors that doctors and researchers believe may contribute to this condition. The only way to protect yourself and your loved ones is to know your family's risk of an aneurysm.
The risk factors for a brain aneurysm are high blood pressure, smoking, certain medical conditions, drug use, oral contraceptives. Women are actually at higher risk than men, and head injury as well. One of the primary risk factors for an aneurysm is a family history.
For those at risk of developing an aneurysm, early detection is crucial. Fortunately, there are non-invasive screening methods that can help identify aneurysms before they rupture.
First test that is usually done is a CAT scan of the brain. That detects whether a patient has bleeding or not. The second test that can be done is a CTA, which is a computerized tomography angiogram. It is very much similar to a CAT scan, but it is a reconstruction of the program of the CAT scan. If the patient has an aneurysm, that could also be picked up. The third possibility of diagnosis could be with an MRA, which is a magnetic resonance angiography.
This is what's called an MRA. It's another way to acquire images of the vessels inside your brain.
Often called a silent killer, most aneurysms exhibit no symptoms. But if symptoms are experienced, it is important to recognize them and get to an emergency room immediately.
Some of the signs and symptoms of an aneurysm rupture is the worst headache of their life. A lot of patients come in complaining of a thunderclap headache. Other symptoms that they may have is nausea and vomiting, blurred vision, double vision, or problems moving their arms and legs.
When we say clipping an aneurysm, it means applying a titanium clip at the neck of the aneurysm to essentially prevent that blood flood flowing into the dome of the aneurysm. So when we strangulate the aneurysm's neck, it prevents blood flow, which obviously prevents a rupture.
Coiling itself, the primary benefit is that it's generally a much less invasive procedure. It's just a small nick of about ½ a centimeter or so in your groin. The objective when you're coiling this is you're putting a microcatheter. It's a very small catheter. You get into the aneurysm, you place it in the aneurysm itself, and then you position a coil. This is done on a fluoroscopic table. It's done under real time.
I had really bad headaches. And then I had some issues with loss of vision in my left eye. Dr. Lee's office called me and told me that I needed to get to the emergency room. I don't know how else to describe it except for to say that I guess in my circumstances, if I was to have to go through it again, they would be the people that I would pick. I mean, it was absolutely wonderful. They checked on me. They made sure that I knew every step of my recovery, what to expect, what I was gonna go through, and just making sure that my family was comfortable.
Kingwood Medical Center has a comprehensive neuroscience team providing treatment and rehabilitation for complex neurological situations, including aneurysms. With a dedicated neurosurgery operating suite and neurosurgical intensive care unit, Kingwood Medical Center is at the forefront of neurological care.
So the Brain and Spine Center has really been an involving program for us over about the past 5 years. We've been primary stroke certified by Joint Commission since 2007, and then recently by SEDTRAC comprehensive stroke certified. And what that means for the public is, in our communities that we serve, patients can come to Kingwood Medical Center and receive all the care they need and not really have to travel downtown to receive tertiary services. So about 2 years ago, I had the pleasure of meeting Natalie Niekro. She's a wonderful woman who is passionate about aneurysms and screenings and really public awareness. Her father passed away very unexpectedly of an aneurysm rupture. Actually, her foundation has subsidized us to be able to provide this video to go out into our community and educate the public, which is really her main focus of her foundation.
Through the growth of this foundation, we're just going to continue to help patients and families and victims and research, and it's exciting to know how far we've come in just such a short time.
For more information about Kingwood Medical Center and brain aneurysms, please visit us at kingwoodmedical.com. If you need a physician referral, please contact us at 800-258-5064.